and then clouds tomorrow and a high in the mid-40s. We should stay mild into Friday with a high in the low 40s.
Programming is supported by the Medtronic Foundation, coming together to strengthen our communities by giving back in service and in partnership with nonprofits. Learn more at medtronicfoundation.org.
Support comes from the InVision Distinctive Eyewear Garrett Light and Matsuda Trunk Show, December 2nd through the 4th. Matsuda frames are handcrafted, and Garrett Light's fall collection is a tribute to LA musicians. Appointments recommended at invision-optical.com.
Good afternoon. It's 2 o'clock. I'm Stephen John. This is NPR News. And on this Wednesday, first day of December, we are about to get an update on the coronavirus situation in Minnesota. Much has transpired on the COVID-19 front in the 2 weeks since the health department last offered up a media briefing, including the emergence of a new variant of concern. And as we have been doing throughout the pandemic, we will bring you the very latest information here live as a public service. Reporters are dialing in for the conference call as we speak here, and we will soon hear from Health Commissioner Jan Malcolm. Time permitting, we will join up with our regularly scheduled program, the BBC NewsHour. The Health Department's Infectious Disease Director, Chris Erzman, is also scheduled to take part and will fill us in on what she knows about the Omicron variant, with the first U.S. case being reported just hours ago in California. We'll also likely hear about the status of vaccine boosters now available to all adults in Minnesota. Stay tuned. Other news we're following today: jury selection is continuing at a steady clip in the manslaughter trial of Kimberly Potter. With that last report, 8 jurors seated since the process got underway yesterday. The former Brooklyn Center police officer is charged in the shooting death of 20-year-old Dante Wright during a traffic stop last spring. We've also learned that a Michigan teenager has been charged with murder, terrorism, and other charges for a shooting that killed 4 fellow students and injured others at Michigan's Oxford High School. Charges against the 15-year-old were announced today, a few hours after authorities reported the death of a 4th teenager from the school in southeastern Michigan. There's Jan Malcolm. Let's begin here on NPR News.
Today, Minnesota is reporting an additional 3,580 laboratory-confirmed cases of COVID-19 and 100 deaths. Important to note that the case number is truly a one-day number, but keep in mind that the total of 100 deaths reflects multiple days of reports coming out of the Thanksgiving weekend. We now are at a cumulative total of 915,942 cases and, heartbreakingly, 9,482 Minnesota lives lost to COVID-19. Our state is still pretty clearly firmly in the grip of the Delta wave. All 87 of our counties are in the CDC's highest transmission category, and that means everyone should really be masking up in indoor public settings. I just want to repeat that. At the rate of transmission we are seeing everywhere in the state, everyone from residents of Apple Valley to Roseau to Zumbrota really should be wearing a mask in public indoor settings. It's hard to imagine that hospital capacity is even tighter this week than when last we spoke, but sadly that is the case. This extremely high capacity in our hospitals is a huge concern for all Minnesotans, whether you need a bed due to COVID, a heart attack, a car accident, or any number of other critical health conditions. Right now, Minnesota has 1,562 patients in the hospital being treated for COVID specifically, including 356 in ICU. Day after day, we just keep setting new highs for the year 2021 in terms of the number of people in hospital for COVID. And again, bear in mind that this year, this fall, our hospitals were quite a bit more full of other care needs than they were last fall at this time before the COVID wave hit. Overall, hospital beds are really tight around the state. Less than 1% of our hospital beds are currently open in the metro region, and about 3 to 4% are open in the southeast and northeast regions of our state. Intensive care unit beds are even more limited. with 1% of ICU beds available in the metro and 3% in southeast, central, and northeast regions. And there are currently no pediatric hospital beds open in the northwest, west central, or south central regions of the state, and no pediatric ICU beds available in the central region. Fortunately, there are a lot of Minnesotans getting vaccinated between primary series, completing the series, and now boosters. And that really does help to reduce that pressure on our healthcare sector. We now have 71.3% of all Minnesotans aged 12 and up who have completed their vaccine series. The numbers are slightly higher if you just look at those who've received at least one dose. But especially with the Delta wave, we know how important it is for full protection to have the complete series. And now for Minnesotans 5 and up, so the entire population over age 5, all those currently eligible, we have just over 64% of that population who have completed their vaccine series, and again, a little bit more than that with at least one dose. I'm really encouraged to say that we also have administered more than 1.1 million third doses or booster doses in our state. And at last report, that led to Minnesota being number 2 among all states for this metric, and that truly is really good news. I'd like to turn to the latest news on Omicron, or Omicron. We've heard it pronounced both ways. As we said earlier this week, we're closely tracking international reports of this new COVID-19 variant called Omicron, technically labeled B11529. The World Health Organization very quickly named Omicron a variant of concern, and scientists are working hard to learn more about its transmissibility and its virulence, as well as how well vaccine a person against it, or how well treatment is effective against it. And literally, information is coming in hour by hour. And while news is breaking just in the last little while here, about the last half hour or hour, about the first confirmed United States case has been found in California, at this point, no Omicron cases have been reported in Minnesota. That said, the history of COVID-19 and the Delta variant in particular shows us that very transmissible viruses can move very quickly around the globe. And we should be prepared for Omicron to show up in Minnesota at some point. Fortunately, our state is positioned quite well to monitor for these kinds of new variants, better than many other states, in fact, because we've built one of the nation's strongest variant surveillance systems and strong genomic sequencing capacity. And having a strong system like this in place in our state makes it more likely that if the variant is here, we will find it and find it quickly. I know there's a lot of concern around this variant, given the news of recent days, so let me provide a bit of context. All viruses, mutate all the time, and each new infection in a person is a new opportunity for the virus to change. That is just one of many reasons why it's so important here in Minnesota and all around the world that we do what we can to limit the rate of those new infections and limit the opportunities for the virus to evolve. We don't want to give this virus any more opportunities to find better ways to infect us and evade our protections. We talk a lot about the importance of making sure that we reduce hospitalizations and, of course, deaths, but this is clearly a sharp illustration of why the rate of transmission itself is a big public health concern around the world. But we clearly don't need to wait for the research to come in over these next several weeks to know some things that we can do to stay on offense, to protect against COVID-19, including all variants. The most important thing that we can do to prepare for Omicron and to limit the potential for additional viral mutations is to ensure that everyone who is eligible, everyone 5 years of age and up, gets vaccinated. And those who are eligible for boosters, which is now recommended for all people over 18, to get those booster doses as soon as possible. Especially a good idea with more and more family gatherings coming up with end of the year holidays. And of course, remember, you can find a vaccine near you by going on the nn.gov COVID-19 vaccine, find vaccine webpage. The other thing we can do to protect against COVID-19, all of us together, is to use those layers of protection that, quite frankly, we've gotten a little bit lax on. That list of layers includes wearing well-fitting masks in indoor public settings and crowded outdoor settings, getting tested if you have symptoms of COVID-19, have been exposed to someone with COVID-19, if you've traveled, or if you've been someplace where there's a high likelihood of your exposure. And on this point, we're grateful that Minnesotans are still testing at robust levels. Another basic thing we can do is to stay home if we're sick, even if it's, quote, just a cold. Wash your hands frequently, be mindful of crowds, stay away from crowded areas, especially indoors. And we should all be taking steps to improve ventilation in our homes, our workplaces, our schools. We also need to take extra care to avoid exposure to this virus if you yourself have medical conditions or if you live with someone who is at higher risk of bad outcomes from this virus. And with that, I'd like to turn it over to Chris Ersman for an update on some promising COVID therapies that are in the pipeline. Chris.
Thank you, Commissioner. You've heard us talk in the past about some of the treatment options for COVID-19, including the use of monoclonal antibodies. While these treatments are incredibly important for preventing severe outcomes of COVID-19, it should be noted right off the bat that monoclonal antibodies are not a substitute for vaccination against COVID-19. Vaccination remains our strongest tool for preventing COVID and preventing severe illness. That said, it is helpful to have treatments for those who do need them. We're working to ensure every Minnesotan in every community has fair and equitable access to monoclonal antibody COVID-19 treatments. However, due to high rates of COVID-19, demand for these treatments continues to outpace the supply of healthcare workers who can provide them. Minnesota had been administering about 2,000 doses a week of the treatment since the beginning of October. It has been increasing in recent weeks. In fact, for the week ending November 24th, we administered more than 3,000 infusions for the first time. On November 23rd, Governor Walz announced that MDH and Minnesota healthcare providers, such as mHealth Fairview, have responded by opening new clinics and adding staff to provide monoclonal antibody treatment in the Twin Cities and in Greater Minnesota. This resulted in a 50% capacity increase for treatments in the Twin Cities. Today, we are announcing that the state has also secured federal support for expanding capacity to administer monoclonal treatment and vaccines, with 16 FEMA personnel coming to Minnesota to help with these efforts. With the FEMA team's arrival, capacity at the Mall of America vaccination site will increase from 1,500 doses per day to 2,000 doses. The site is popular with families seeking vaccination for 5 to 11-year-olds, as well as vaccinated Minnesotans seeking boosters. Since November 3rd, that site has administered nearly 14,000 doses to 5 to 11-year-olds, and it administered 800 booster doses to adults last week alone. The FEMA team will also allow more COVID-19 patients in central Minnesota to receive the monoclonal antibody treatment. The administration and medical providers around the state are working to increase accessibility of monoclonal antibody treatments. MDH has worked with the University of Minnesota and the Mayo Clinic to learn who benefits the most from these treatments and to update the Minnesota Resource Allocation Platform, MNRAP, referral system that helps match those who most need treatment with available appointments. Because of these improvements to MNRAP, when demand for monoclonal antibody increases, the Minnesota healthcare system will give priority to treating patients who are ill and who have the highest risk of developing severe illness and requiring hospitalization. There are also some new treatments in the pipeline that may receive emergency use authorization from the FDA soon. One of those treatments is a new oral antiviral from Merck called molnupiravir. The FDA's advisory committee met to discuss this new treatment just yesterday. The other new treatment is called tixagevimab and silgavimab from AstraZeneca. It's often referred to in the shorthand of AZD, and after I just pronounced that, you can understand why. It's a combination of two monoclonal antibodies given by an intramuscular injection, a shot. We expect to get more information on both of these treatments in the near future as they go through the process of receiving official authorization from the federal government. We expect demand for these new treatments to be high, but supply is expected to be low initially. States will receive an allocation of each medication on a weekly or bi-weekly basis when the time comes. We are already planning for this by working with providers and the Minnesota COVID-19 Ethics Collaborative and the MDH Science Advisory Team to determine how to allocate the supplies, similar to previous plans for other therapeutics like remdesivir. Once we have more information from our federal partners, we will keep you updated on distribution plans. As I mentioned, these treatments are very valuable, but the key thing we need is for Minnesotans to take every possible step to slow the spread of COVID-19 so we can bring case numbers down and limit the number of people who even need treatment with these medications. And with that, I'll turn it back to you, Mike.
Thank you, Chris. Operator, we're ready for questions.
You're listening to a live press briefing on the coronavirus situation in Minnesota from the Department of Health here on MPR News.
You will need to press star 1 on your telephone, and to withdraw your question, you may press the pound key. And first question comes from the line of Peter Cox from Minnesota Public Radio. Peter, your line is now open.
Thank you. I'm curious how Minnesota's booster supply stacks up to the demand we're seeing right now, and if you've seen a change in demand just because of this new variant and the spike we've seen.
Well, I'll start and then ask Chris to comment as well. Definitely, we are gratified to see the demand and people seeking out the booster shots. As I mentioned, we're second in the U.S. on that measure. We do have still a very, very good supply of vaccine in the state. So we have enough vaccine to meet the demand for primary series and enough pediatric doses for 5 to 11, as well as adequate doses for boosters. But Chris, you may have some more specific comments you'd like to make.
Sure. So yes, we're very pleased. We have seen the increase in boosters, the uptake increase, and I think in part that has been helped by the clarifying language from CDC that has indicated that everyone 18 and older should receive a booster. I think it was a little bit confusing initially, but now the language is very clear that everyone 18 and older should receive a booster. And as the commissioner said, yes, we have plenty of vaccine available across the state. We have asked for additional vaccine from our federal partners, and they have provided that for us. So our vaccine supplies are in a very good place to, handle the demand for boosters.
Along those lines, we do now have a federal kind of deadline for the mandate in nursing homes. I'm wondering if we have seen an uptick in nursing home workers getting vaccines and where those things stand right now.
Yeah, I think Chris may have some data on how vaccination rates have improved, but important to note that just last night, a federal judge did put a stay on that regulation of that rule from CMS for our long-term care workers and healthcare workers. So while the mandate implementation has been put on hold, at least for now, we continue to work really hard, as do our long-term care and hospital providers, to encourage employees to get vaccinated. It's certainly important for their own health and safety, but especially so for that of the vulnerable people for whom they're providing care. Chris, do you have some data on the recent trends? Did we lose Chris?
I'm sorry, Commissioner, I got stuck on mute.
No problem.
We don't have specific data, Peter. I can get that for you when the call is done. But to your question about increase, what we've seen over time is that vaccination coverage in staff for both our assisted living and our long-term care facilities has increased over time. There was a reluctance early on, and over the course of the last number of months, as there's been more experience with vaccines and continued to be encouragement on the importance of staff getting vaccinated, we have continued to see that proportion increase. And we'll get you the exact numbers.
Thank you.
Next question comes from the line of Bill Werder of Minnesota News Network. Bill, your line is now open.
Thank you very much. Commissioner, since the first detected Omicron case in the U.S. appears to be a breakthrough case, does that give you any concern about vaccine efficacy? And I guess a closely related question is then long-term, a lot of folks are wondering, I think, does this continue mutating, and do we continue perhaps having to have new vaccines developed long-term, or at least boosters for an extended period of time? Do you have any thoughts on that, Commissioner?
Well, Bill, I would just first reiterate that this is so new, and there just is not, there are some things that we can hypothesize about based on the work that's going on to understand where these specific mutations are on the virus and how those compare to prior variants. But there are some of these mutations that have not been seen before. So we just don't know yet about critical questions like vaccine and treatment effectiveness and transmissibility and severity. So those are all critical questions everyone's eager for answers for, but quite honestly, it's going to be several weeks probably before the data are clear about those questions. I think the fact that we don't know the answers to those questions does not mean that we shouldn't keep doing what we know is helpful in all cases. And we do continue to, again, stress that we've said many times we sort of feel like we're in a race against time to get as many Minnesotans vaccinated as possible. And I think now that race just got even a little more time urgent with Omicron. But Chris, would you want to comment any further on what we know and what we don't know with regard to breakthroughs or likelihood of future boosters?
Right. Well, I think that the commissioner did a good job of explaining that, things are very new, and there certainly are, some hypotheses, as she said, that we can suppose based on where some of the mutations have been identified in the viral genome, but there are still a number that we don't really have good information on. So we really have to give it time, and I think it's important that we don't rush to judgment on this new variant. We need to fully understand it. But even with Delta, certainly we've seen breakthrough illness with Delta, but we know that individuals who have been vaccinated and have a breakthrough illness, it tends to be much milder. And so we haven't seen the same level of hospitalizations and deaths in vaccinated individuals. So we still obviously have much to learn with Omicron or Omicron, however you choose to pronounce it. Since just a week ago, we weren't talking about it. But I think that, we know that vaccine does provide protection, and, that is the foundational tool in our toolbox to be supported by the layered mitigation that we've talked about, masking, social distancing, all of those things. So yes, I think we're going to continue to look closely at what we see related to vaccine effectiveness, but it is much too early to draw any conclusions.
May I just ask a quick follow-up, because we've got over a year now under our belts on dealing with COVID and the variants, and more are emerging. From your experience as health professionals in epidemiology, should Minnesotans get ready for just the COVID being something kind of like the flu or the common cold, but at a much more obviously higher level of threat, but that it's going to be something that's going to continue over a long period of time, and we're going to have to get shots, periodically? Do you have any thoughts on that from your experience in dealing with similar kinds of epidemics?
Well, again, I'll certainly invite Chris to comment. She's been working on vaccine-preventable diseases for much of her career. Again, I think it's been pretty clear for a while now, and I think we've heard this from our federal leaders as well, that this does not appear to be a virus that is going to be eradicated, like some have been, but rather will continue to be with us in some form, and hopefully increasingly manageable with vaccination and with these tools that we have. In terms of the likelihood of regular boosters or regular shots like we do annually with the flu, I think that remains to be seen, but is certainly possible, and some have said likely. But Chris, I'll defer to you on that.
Thank you. The one comment that I'll make, is just that the vaccine has not been available globally at the same level that we've had access to it here in the United States. And so, for as long as we are seeing rapid transmission in other parts of the world, the probability of having new variants develop, remains a concern. As the commissioner said, mutations in viruses are very common and come about as a result of replication, which happens as the virus is transmitted. And so because of that, we can expect that there potentially will be additional variants that emerge. But so I think people have to be prepared for that, and we need to move to a level in which vaccine is available, for as many people as possible, and as we've talked about, as many people as possible take advantage of it. And I think, as the commissioner said, this does not appear to be, a disease that we can eradicate. There need to be certain characteristics in order to have that hope. So our goal really is to have COVID become what we refer to as endemic. That means it's a disease that's in the background, all the time. It continues to occur, but as the commissioner said, we were able to manage it, and really that's what we do with influenza. It continues to occur, but both because of vaccinations, because of antivirals, because of experience in treatment, we're able to manage that disease. And so, our goal will be to learn as much as we can about SARS-CoV-2, and we certainly have learned a lot in the 22 months, but we recognize that this virus, it's humbled all of us, and so we will continue to learn. But I think that it is something that we will need to be thinking about how we manage it over time in the long term, and that may involve regular booster vaccinations.
Thank you both for the extra time. Appreciate it.
Next question comes from the line of Jeremy Olson of Star Tribune. Jeremy, your line is now open.
Yeah, hi, Commissioner. You had said we'd gotten a little lax on some of the protective measures, and first, they're a little unreliable, but the online surveys that you look at on IHME and others, they show that Minnesota went from a mask-wearing rate of about 80% down to about 10%, and now it's about 20%, so it's recovered a little, but it's still among the worst in the country when you look at these survey results. I'm just wondering why, if you could opine on why we, went from one of the highest to one of the lowest, what factors caused that, and if there's anything to be done about it.
Boy, Jeremy, I would love to know the answer to that question for a lot of reasons. But I'm glad you cited those statistics, and I think a lot of us kind of have that same sense or can confirm that through our own travel or travel of colleagues or family. Had just a number of people in the last few days say, gee, I was in Chicago or I was in D.C. or I was here or there, and there's a lot more mask wearing there than there is here. And why is that? I think certainly we're all tired of the pandemic. Not sure why that might be more true in Minnesota than elsewhere. But it's certainly a concern, and that's why we've been sort of again returning to talking about not just the importance of vaccinations, although that is absolutely the strongest tool in the toolbox, but the value of going back to some of those other layered mitigation strategies as well for all of us, whether vaccinated or not. It could be, since we've done a pretty good job of getting a lot of the eligible populations vaccinated, early on, that was part of the issue. That most folks, many folks have been vaccinated and therefore think they don't need to worry about masking. But I think the data have gotten more and more clear that that's still really a good idea, even for vaccinated folks, given Delta.
And another question regarding preparation here, and is just any thoughts about the rapid antigen testing and our use of that. There's been some discussion in different circles that could be used early and often in different places as kind of as an early warning sign for an uptick in infections or the arrival of new variants or things like that. I guess I'm just wondering if you have any thoughts on whether Minnesota could use rapid testing in a different way or a more strategic way than it is right now, which is just kind of put it on the shelf and let people buy it.
I think it's a great question, and I'm sure Chris has some thoughts on this too, but yes, definitely. I mean, I think we do see an important role for rapid testing for a lot of purposes, including kind of surveillance, as you say, but also as a way of helping people know their status on a pretty regular basis so that they can take appropriate actions. We have done a lot to acquire more rapid tests in the state, and we're glad to know that there is more in development, that the federal folks are putting a high priority on increasing that supply and procuring more. And there are just more and more tests of higher and higher quality being developed all the time, and that's a very good thing. Chris, what would you add?
Well, yeah, a couple things. One is we have worked to make the rapid antigen tests available in strategic sectors, offering them to schools and things like that. Sometimes, the operationalization of making tests available can be challenging when you're also dealing with COVID. So while, they have been made available and are being used in many locations, it's not without its effort and work on the part of those sectors that are doing so. The other thing that I would acknowledge is that they can serve as an early warning, and they can help us, by making sure that people know their status. But if people aren't willing to take the necessary actions, we're not any further ahead. So in other words, if you do a rapid test and find out that in fact you're positive and then decide, well, you know what, I just did this at home and nobody knows, and I'm going to go ahead and do what I want to do, that won't move us ahead either. So I think they definitely have a place, and we are deploying them and encouraging their use. But we need not only the rapid testing, but we need the action, appropriate action to follow. And then I do think as well, we've talked about, masking and things like that, which are quite simple to do and can have a big impact. So testing is an important tool in the toolbox, but it's one of many, and we want to make sure that people are using all of them.
Thank you.
Again, if you have any questions, please press star 1 on your telephone. Oh, we have a follow-up question from Jeremy Olson. Jeremy, your line is now open.
Well, I'm not going to miss the chance. Commissioner, I guess this would be almost a combo question, but you had made decisions today regarding the medical marijuana program and a medical cannabis program and regarding not adding anxiety as a qualifying condition. I ask because anxiety, as mental health professionals say, is way up in the pandemic right now, and so no new therapeutic options could have been valuable. Did that weigh on your decision at all, the anxiety levels in the current pandemic, or not? And tell a little more on your decision, I guess.
Well, sure, Jeremy. It's a good reminder that there are other issues that we're working on too, in addition to COVID, of course. And I'll note just lots of concerns about other chronic illnesses having been exacerbated by COVID, and much work to do. With respect to medical marijuana, I think the reason for not adding anxiety was because it's such a broad category, and I think those who helped to review the petition, we get a lot of feedback from experts in the field, just felt like the definition was overly broad, but that more research is definitely indicated to see are there specific subsets of anxiety disorder for which this might be a valuable additional treatment. I think some of the thinking was that there are effective treatments. So it's not like there aren't treatments available, but your point about additional options is very important when there's kind of clear evidence of risk and benefit that we can weigh. And I think, again, this condition's been petitioned a few times. There wasn't any new research to be able to draw on, but I think it's also just a question of that's just a really broad category, and it might be more appropriate to look at more specific subsets.
Thanks for answering the tangent question.
Next question comes from the line of Bill Werner of Minnesota News Network. Bill, your line is now open.
Yeah, thanks, Commissioner. As my colleague, I'll take advantage if the opening is here, if you don't mind. The president was here yesterday, and he said tomorrow he's going to have a new announcement about how to proceed in the latest onslaught from COVID, specifically the Omicron variant. What are you looking for from him? What would you like to see from him?
Well, I think we always welcome, kind of clarity from our federal partners and as much of a kind of consistent approach as we can get across the states. I mean, again, Omicron is a great reminder that viruses don't respect geographic or political borders at the county or state or nation level. Clear federal priorities are always helpful to us. We hope that there will be kind of a continued commitment of federal resources to help the states as we manage through these surges, this unrelenting Delta surge that we've been in for months now here in Minnesota. We certainly are benefiting from some of those federal assets that we've been able to request, but we could use more. So we're hoping that there's continued, federal partnership around some of those surge assets, if you will. And the earlier discussion on testing, as has been true since the beginning of the pandemic, we really need strong leadership from the federal level to make sure that that the supplies of these critical tools are as robust as they can be, rather than having the states kind of, pitted against each other to try to get what we can find. So I'm hopeful to hear, kind of more about the federal strategy for increasing support for vaccination and testing going forward.
The president seemed to take shutdowns or lockdowns off the table in his comments yesterday, at least in Rosemount. He indicated that wouldn't be part of the strategy. Does that is that premature to make that judgment, do you believe?
Well, as I understand it, what he said was they're not on the table at this point. I don't think he's ruling that out forever, but I think, he too has said, as has Governor Walz, and we've got a lot of tools to be able to manage this without resorting to that if we use the tools. If we, just really put on a real effort to get everybody vaccinated. Now, I mean, again, if folks were not feeling a lot of time urgency, Omicron is a good reminder that time can matter a great deal. So I think between encouraging vaccination, testing, masking, and all of those strategies that have served us really quite well, I think that was his point, that we need to deploy the knowledge and do what we know works. But at this point, those tools hopefully will make it possible to not have to rely on some of those really, kind of blunt instruments, if you will.
Thanks, Commissioner. Appreciate it.
I would now like to turn the call over back to Mr. Michael Schomer.
Thank you. That is all the time we have for today's call.
And that's a wrap for today's conference call here on NPR News with the Health Commissioner Jan Malcolm, Infectious Disease Director Chris Erisman, answering some questions at the end from some reporters. Jan Malcolm starting the hour with a reminder that Minnesota is still pretty firmly in the grip of the Delta wave. And based on the number of cases, everyone should be wearing a mask in public indoor settings. She said hospital bed capacity is still tight, 1% of beds available in the Twin Cities. But the encouraging thing, still vaccination rates are high in Minnesota. In fact, Minnesota is number 2 among all states in getting booster doses in people's arms. First U.S. case of the Omicron variant showing up today in California. They just touched on that, and admittedly, don't know exactly how to pronounce it either. Omicron. It is not here yet, but we should be prepared for it to show up at some point. But the state is in good shape with its ability to detect and track the various cases and variants that have been coming down. All viruses mutate, we were reminded, I guess in an attempt to tamp down some of that concern, and that's why it's important to diminish the ability for that to happen by decreasing the number of potential human hosts with that, again, reminder to get vaccinated when you're eligible. All people 5 and up now can get vaccines, and all adults, of course, can get the booster shots for the coronavirus. Interesting bit of news, I guess, made in today's discussion was from Chris Erisman that the state is soon going to be hosting 16 FEMA personnel to help administer a treatment. They've been talking about this monoclonal antibodies treatment, but they just haven't had enough trained professionals available to keep up with the demand for the treatment, but that could change soon with the federal folks arriving before too long. So that's just basically in a nutshell what were some of the highlights from the Health Department conference call. We will continue to bring these to you live as they happen here as a public service on NPR News, and we will also bring you more on what was said today on the air and online at nprnews.org. I'm Stephen John. Thanks for taking us along today, and coming up, All Things Considered at 3 o'clock. But in the meantime, we're going to wrap up the hour with our regular program, the BBC News Hour.
To be seen as an alternative to China's Belt and Road Initiative. Here's the European Commission President Ursula von der Leyen with backing band on the promo video.
We will build global gateway partnerships with countries around the world. We will take a values-based approach, offering transparency and good governance to our partners. We want to turn